Hi guys, how are you? Welcome to another episode of my channel. Today we are talking about meningitis. Not so common, but it occurs. Meningitis is inflammation of the meninges and the fluid surrounding the brain. You do have a viral kind of meningitis, and then you do, let me move this a little bit aside. There's viral meningitis and there is bacterial meningitis. In most cases, viral meningitis can go away on its own. The bacterial is more severe. You can be dead within such a short time. So it's important to know the side effect, the effects of what it is for meningitis. Viral, you'll get better with viral. Bacterial needs to be treated. It is so severe and it comes on so fast and you can lose your life for it. So we'll go through the signs and symptoms and I'll walk you through what it is to watch for with bacterial, mainly with bacterial meningitis. Signs and symptoms: stiff neck, that's a huge one. Stiff neck and severe headache. Severe quick onset headache and severe stiff neck is the main two symptoms that people watch for, but there are other symptoms. I'm going to look at my notes there. Sudden high fever is one of them. Stiff neck, severe headache, nausea, vomiting, trouble concentrating, or confusion that comes on so suddenly. That's another sign and symptom. Seizures. By the time you're having seizures, it's gone really fast. So seizures is one of them. Sensitivity to light, which comes with a headache, but the main ones: stiff neck, severe headache, and seizures. That's the main one. So if you're having any of, and that's in adults, if you're having any of those symptoms, go be seen immediately. Especially the stiff neck in a grown up and you didn't sleep wrong, but you're just having a severe stiff neck with severe headache, get checked out immediately because bacterial meningitis needs to be treated so fast. Viral meningitis will go away without treatment. Bacterial meningitis, you want to treat it before it goes to the spinal cord. That's the urgency of having it checked out. Those are the symptoms in an adult. In children, it's a little bit different. It's harder to tell, actually, so to speak. It's, as a new parent, I see how many people would miss that. It's a really difficult one to tell. But in children, constant crying, high fever, being very sleepy or irritable. That's weird because children are sleepy and irritable sometimes. Trouble waking up from sleep. That's another symptom. Being inactive or sluggish. A baby that's bouncy and everything. Being inactive or sluggish. Not waking up to eat. Babies like eating, so if they don't wake up to eat, then you're thinking something else is going on. Vomiting, and then a bulge in this soft spot. You know the way that babies have a soft spot here? If it's bulging, that's a symptom that you need to have it checked out by the pediatrician as soon as possible. Stiffness in the body and neck. On a baby, it's hard to tell. It's hard to tell. If it's a little bigger baby, then you're able to tell if they have stiffness. But a little baby, you can't tell. If the baby is 5 or 6 months, you may be able to tell from the fontanelle, but otherwise you wouldn't be able to tell if the baby has a stiff neck or not. So these are just mother instincts where you're watching the baby carefully and you can tell something is off. Then you find the signs and symptoms, have the baby checked out immediately. So that's the signs and symptoms in a baby. Much harder to tell. They're caught on much later because not many people catch them, but that's what to watch for in babies. When do you see a doctor? The fever is getting worse. The headache is not going away. The stiff neck is not going away. And this is not a stiff neck that you slept wrong. It's just a stiff neck that you're having that is constantly there. So if you're having those symptoms, confusion, vomiting, get that checked out. Get that checked out. It's a rare disease, but you see it once in a while. Once in a while. I lost my brother to it and he was basically in the hospital for one night. And he went, so obviously it was bacterial meningitis, which was not caught on time. And so they didn't treat it on time. Viral meningitis, you don't need the treatment. You don't need the antibiotics. It goes away on its own. It's serious, can cause death within minutes and days without prompt antibiotic treatment. So get that checked out as soon as possible if you're having those signs and symptoms. The diseases are so many. The signs and symptoms are hard to keep up with, but as best as we can. When they say, if you know better, you do better. When you know those symptoms is when you get them checked out. But if you don't know them, then it's harder for you, or you will get it checked out, but it may be late for you. So it's easier if you do have at least a clue of something, or if you have a slight idea, then you can shift your thinking in terms of, this may be this. So those are the main things. What are the causes? For bacterial meningitis is usually bacteria has entered the meninges. That's what happens with bacterial meningitis. It travels to the brain, and spinal cord is where it travels to. It goes really quick. That's why you need to get in immediately, get on antibiotics, and start treatment for it. It can be caused by an ear or sinus infection that travels, so be wary of that. Or skull and fracture. Hopefully you don't have any of those, but that's how fast it travels, so have that checked out. Another one we have is, we're talking about the viral. I keep saying viral, and you guys may be wondering which one is the viral one. The viral one often clears on its own. You don't need antibiotics for it. It's not as dangerous as the bacterial meningitis one. It's not as dangerous. The most common times we have them is late summer and early fall. Viruses such as HSV, herpes simplex virus, can cause you to have the viral meningitis, and then West Nile virus, which is common, and others can also cause the viral meningitis. There are people who have chronic meningitis, just long lasting, doesn't go anywhere. It's treated, the flares go down, it comes back. It's treated, the flares go down, it comes back. But there's now a fungal one that I saw in the news that's coming up, and is going to be harder to treat. But if you know the signs and symptoms, and then you get a good treatment for it, then it's easier to get rid of it. But the chronic meningitis, chronic means you've had it for more than 3 months. Anything less than 3 months is acute. Anything more than 3 months is a chronic one. So chronic meningitis, you've just had it for longer than 3 months for most people. It develops over 2 weeks or more. The signs and symptoms are similar to acute meningitis, which is the sudden severe onset stiff neck, severe headache. They include headache, fever, mental clogginess. So that's what it is. And then you have the fungal meningitis. It's not so common in the United States, but I've seen there's an outbreak in a certain country. I don't remember which country it was. It actually mimics the bacterial meningitis, but it's often contracted by breathing in the fungal spores. That's how you contract that one. So you have to have breathed that in to get the fungal meningitis. That's the most common one, found in soil and birds. So like bird soilings and stuff, you're easy to, if you breathe in that stuff, then you're more prone to get the fungal meningitis, and that's why it could not be so common in the United States. That's the difference, that it's broken out in another country but not here so much because of that. It's not spread from person to person. This one is from animals breathing in that fungus, and birds. Those are the main three that I saw. It affects people with weakened immune system, such as HIV, AIDS. Their immune system is always lowered, so they are usually apt for a lot of bacterial infections from secondary stuff. These poor people, yeah. Even with treatment, fungal meningitis may come back, unfortunately. And then you have parasitic meningitis. I'm looking at my notes, so if you see me looking aside, I'm looking at my notes because I'm not so familiar with the fungal and the parasitic. I'm familiar with bacterial meningitis, which I saw in the hospital, and which was my brother dying of it. And then viral meningitis, because you get better without treatment. But this parasitic and fungal, I have to look it up because that's new to me. I'm not too familiar with them. Parasites can be a rare type of meningitis called eosinophilic meningitis. It can be caused by tapeworm infection in the brain or cerebral malaria. Oh, that reminds me, cerebral malaria is another topic I need to talk about. A friend of mine did get it, so I have to talk about it. She was in a coma for a while, so that's an interesting topic to talk about. But that's what causes the parasitic meningitis. Amoebic meningitis is also another rare type of parasite meningitis, but it does occur too. Contracted through swimming, so that can be anywhere. Anybody can get that one in fresh water, and also can be quick to be life-threatening. So be careful. As long as you have an idea of what the signs and symptoms are, I feel like a lot of people can remember. But the not so common diseases, it's really hard for us to catch some of this stuff. It's hard for common people to catch the stuff. So the more we know, the better we are. It's a learning game. Everybody learns every day. We learn new things every day. We learn new things, and the better you know, the more you're more aware of what diseases these are. Other meningitis causes can result from non-infectious causes, chemical reactions, drugs, some type of cancer, or inflammatory diseases such as sarcoidosis. So those are the main causes, but as I told you, the main one is bacterial meningitis and viral meningitis. Bacterial, more serious, it's life-threatening. Viral, you heal without medications. Bacterial, you have to have the antibiotics to get better. Risk factors: skipping vaccinations, exposure to the fungus. If you're exposed to, you're inhaling that fungus, and that's how you get your fungal meningitis. Exposure to that, the buddings, the bad soils. If you're exposed to that and you inhale that, that makes you at high risk for it. Age: most cases of viral meningitis occur in children younger than 5. So if we don't know what the signs and symptoms is, even as a parent, it's hard for you to catch what it is that it's causing this child to feel icky and stuff like that. And it may be hard for a child that age to tell you they have a stiff neck in their language, in the best way they know how. It may be a little hard for them to explain to you that they do have a stiff neck. Headache, they can tell you, my head has a owie or something. Stiff neck is a little hard for a child to tell you. So it's more case of a parent who's more in tune with the child notices that something is off with that child, and that's caught a lot faster. Living in a community setting, college settings, dormitories, military bases, daycares, anywhere that a lot of people congregate is a risk factor for it. Pregnancy increases the risk of infection, so that's another pregnancy. Weakened immune system for sure. Cancer patients, chemotherapy, it weakens the immune system. HIV or AIDS patients, their immune system is weakened, so they're more likely to get infections than a healthy person would get. That's a risk factor. There are complications to meningitis. The main one is hearing loss, memory problems, brain damage, trouble walking, seizures, kidney failure, shock, and the worst of them being death. Because if you don't get it fast, then it's death. So those are the main ones. But with prompt treatment, it's treatable. It's treatable, especially if you can tell quickly that this person has had a severe headache, seizures, and is having a stiff neck. Those kind of stand out. Seizures are not so common to have, but when you have it, then something is seriously off. So that's another way we can look at it and remember the stiff neck, severe headache, nausea, vomiting with it, seizures, main ones. Those at least you can tell, oh, it's weird, I didn't sleep wrong and I have this severe stiff neck that's not going away. Or severe headache in that case. Severe headaches that don't go away are dangerous in any sense for me. I've always thought headaches that don't go away are dangerous. Is it an aneurysm? Is it this? Is it that? So severe headaches that do not go away, no matter what, need to be checked out. If it's a headache, you take Tylenol, it goes away, no big deal. But severe headaches that do not respond to any medications and are not going away, always check those out. The worst that can be, they'll tell you there's nothing wrong, but at least you checked it out, because it can cause a seizure too. It happened. So that's what it is. Prevention: practice good hygiene, good hand washing, eating healthy, maintaining an optimal body weight, exercising, cover your mouth when you sneeze. It's coming into the season of cold symptoms. Cover your mouth, rest. Lots of rest will keep you away from many diseases. So that's the main way. If you're pregnant, take care with food. Make sure you're eating the right, well-cooked food. That's the main one. And then getting a vaccinations. Get your vaccinations. Get your vaccinations if you can. Children's vaccinations. Have them have the vaccinations. Those are the main ones. Those are the main ones. It talks about diagnosis and treatment, but we won't go into that. That's hospital. You'll have gotten to the hospital, they'll help you. They'll do a spinal tap, they'll do blood cultures. And so they do a spinal tap on your back, take a blood sample. So those are the tests that they can do for you, but mostly they do it real quick where they can be able to treat you quickly. So that's another topic. You guys have an amazing week, and we'll see you next week. Bye-bye.